I will first start out by introducing myself to my patient. I'll say, hi, my name is Kate. I'm going to be your nurse today. And then I will check on their armband and ask if they will please verify their name and date of birth for me. Then I will explain my procedure. I'll say, I am going to insert a nasogastric tube in one of your nares down your nasopharynx and into your stomach to supply adequate nutrition. I then would close the door, close the curtains for privacy, and perform hand hygiene. I then would go to my patient's bed and I would raise it to a comfortable working height. I would raise my patient's head into the high Fowler position, and I would lower my side rail. I then would assess which nares to use by plugging each airway and seeing which one has better airflow. I then will put a linen saver on my patient's chest. Next, I will prepare my equipment. I will rip off tape for later use. And then I will attach my 60 milliliter syringe to my one-way valve. Next, I will apply gloves. And I will measure my nasogastric tube. I will measure from my patient's nose to their ear and from their ear to their xiphoid process. I would then tape off the measurement and then I would coil the distal end to promote flexibility. At this point, I would give my patient their basin as well as a cup of water. I then would lubricate the tip of my nasogastric tube with a water-soluble lubricant, and I would instruct my patient to extend their head back as I advance through the nasopharynx. I then would place the NG tube in their nares towards their septum and downwards. I then would instruct my patient to flex their head forward as I continue to advance, making sure to swallow as I am advancing. And if at any point my patient were to experience respiratory distress, I would immediately pull out the plug. I will continue as my patient swallows, and then I will temporarily tape my nasogastric tube to my patient's cheek. I then will assess for placement. I would ask my patient to first speak for me, and then I would look in the posterior pharynx and make sure the tube had not coiled. I would aspirate gastric juices, and I would plug my clamp and test my pH. If everything looked good, I would go ahead and secure my patient's tube to their nose. And I would also secure it to their gown. I then would discard of all of my equipment take off my gloves and perform hand hygiene. I then would raise my patient's side rail, lower my patient's bed, put their head at a 30-degree angle and place my patient's call light within reach. I then would verify placement with a physician's order of an x-ray and document. Okay, that completes the insertion of my NG tube. Now I will remove my patient's NG tube. I will start by introducing myself. I'll say, hi, my name is Kate. I'm going to be your nurse today. Could you please verify your name and date of birth for me? I would then close the curtain and perform hand hygiene. I then would raise my patient's bed to a comfortable working height. I would put on a clean pair of gloves. I would place a linen saver on my patient's chest, and I would remove the tape from my patient's nose. I then would disconnect the suction, and I would ask that my patient hold their breath as I take the nasogastric tube out in a swift and steady motion. I then would take the tip of my nasogastric tube and wrap it in a Kleenex. I would discard in a red biohazard bag. I then would take my dominant hand and place it to the patient's nose and clean up anything that was left over on the patient's nose. I then would clean up my area, dispose of equipment, and remove my gloves. I would give my patient a wet cloth for hygiene, and I would lower my patient's bed. And then I would perform hand hygiene, and I would document. And I would make sure that the call light was in reach of my patient.